The next time you get a cut, you'll probably grab a bandage, maybe some antiseptic, maybe nothing at all, because you know it'll be fine. But imagine that same cut, same depth, same location. 10,000 years ago, no hospital, no antibiotics, no sterile gauze, no way to know what infection even is. That cut could kill you in a week, and yet somehow our ancestors didn't just survive wounds. They survived catastrophic ones. Spear punctures, broken skulls, amputation, evidence of surgeries so complex that modern doctors have looked at the ancient healed bone and had to ask, how? For 300,000 years, before penicillin, before germ theory, before anyone knew bacteria existed, humans were getting torn apart by the world and putting themselves back together. The methods they used will disturb you. Some of them will genuinely shock you, and at least one of them, science is quietly starting to admit, actually worked. First, you need to understand how violent that world was. Not violent like a bar fight. Violent like everything is trying to end you. Skeletal remains from prehistoric sites tell a brutal story. Researchers analyzing bones from burial sites across Europe and Africa have found that roughly 1 in 4 prehistoric individuals showed evidence of serious traumatic injury. Healed fractures, embedded projectile points, slash marks from weapons. Crushing injuries consistent with animal attacks. That is not a bad week. That is life. These people were not fragile. They could not afford to be. So when something tore through the skin, and it happened constantly, they had to do something. The most immediate problem with any wound is not actually infection. It is bleeding. And here is what is fascinating. Prehistoric humans understood this with a precision that required no medical school whatsoever. They packed wounds. Specific plants were used across completely unconnected cultures on opposite sides of the planet to do the same job, stop bleeding and seal tissue. Yarrow has been found in Neanderthal burial sites dating back over 60,000 years. The plant has documented compounds that promote blood clotting. Whether Neanderthals understood the chemistry is irrelevant. They knew it worked, and they kept using it. Sphagnum moss was used as wound packing by indigenous groups from North America to Northern Europe. It is naturally acidic. It is highly absorbent. It creates a hostile environment for bacterial growth. British and Canadian field medics were still using it as emergency wound dressing as recently as World War I because it worked better than nothing. But stopping bleeding was only the beginning, because here is where it gets genuinely unsettling. We have skulls, thousands of them, from every continent, dating back as far as 7,000 years with clear evidence of a procedure called trepanation, deliberate cutting, scraping, or drilling of a hole through the living human skull, and the bone shows healing. That is the part that stops researchers cold. Not that it was done, but that people survived it. Trepanation is the oldest known surgical procedure in human history, and it was not rare. In some burial populations, the rate of trepanation is as high as 6%. In one prehistoric site in France, 40 skulls were found, and 5 of them had been trepanned. Multiple had been done more than once on the same individual. A study examining trepanned skulls across more than 100 sites globally found that in several populations, the majority of patients lived long enough for the bone to grow back. Think about that. Someone is cutting open a human skull with stone tools in a world with no anesthesia, no sterile environment, no understanding of the brain, and most patients are surviving. Why were they doing it? Theories range from relieving pressure after head trauma, which is exactly what a modern neurosurgeon does for brain bleeds, to treating epilepsy, migraines, or what we would today call mental illness. The reason does not matter as much as the outcome. They were doing brain surgery, and it was working. Now let us talk about what happened after the bleeding stopped, because that is where infection comes in. And infection is what actually killed most people in the pre-antibiotic world. Here is what nobody talks about. They had antibiotics. They just did not call them that. Honey has been used as a wound dressing in almost every ancient medical tradition on Earth. Egyptian, Greek, Roman, Ayurvedic, Chinese. This seemed like folklore until researchers actually tested it. Honey pulls moisture out of tissue. Bacteria need moisture to reproduce. It also produces hydrogen peroxide through enzyme activity. Raw honey has demonstrated real clinical effectiveness against some of the most antibiotic-resistant bacteria known to modern medicine. The Egyptians were packing wounds with honey and calling it medicine in 1550 BC. They were right. Garlic was used in ancient Greek and Roman battlefield medicine. The compound released when garlic is crushed has measurable antimicrobial properties against a wide spectrum of bacteria. And then there is mold. Specifically, bread mold. Ancient Egyptian medical texts from 3,000 years ago describe applying moldy bread directly to infected wounds. For a century, historians called this superstition. Then, in 1928, Alexander Fleming noticed that a contaminated petri dish had a mold that was killing the bacteria around it. They were not being superstitious. They were doing empirical medicine. They observed that moldy bread reduced wound rot. They could not explain why, so they did not. They just kept doing it, because it worked. Beyond plants and mold, their toolkit gets significantly darker. Suturing goes back at least 3,000 years, but the materials were not what you would want near an open wound today. Human hair, plant fibers, animal sinew. In some cultures, the mandibles of large ants were used as natural staples. The ant would bite the wound edges closed, then the body would be removed, leaving the jaws locked in place. This technique has been independently documented on multiple separate continents. Cauterization, burning a wound closed, goes back to ancient Egypt. It is crude, it is agonizing, and it works. It is still used in emergency medicine today. Amputation is documented in prehistoric skeletal remains. A paper published in Nature in 2022 described a skeleton found in Borneo, estimated to be around 31,000 years old, belonging to a young adult who had had the lower leg surgically removed. The bone had healed cleanly. The individual lived for years afterward. The surgeon had no metal tools, no antibiotics, no formal anatomical training, and the patient survived. Here is the part that changes how you look at modern medicine. We spend enormous energy congratulating ourselves on how far we have come, and we should. Modern trauma surgery, antibiotics, anesthesia, sterile technique. These things are genuine miracles, but we have also spent a long time assuming that everything before them was ignorance. That assumption is starting to crack. Researchers studying honey-based wound dressings are publishing results in peer-reviewed surgical journals. Maggot therapy, using sterile fly larvae to clean infected wounds, was abandoned when antibiotics arrived and is now being reintroduced in hospitals because antibiotic-resistant bacteria are winning. The World Health Organization now has an entire division dedicated to documenting traditional plant medicines before the knowledge disappears, because a significant percentage of them have confirmed pharmacological effects. We did not invent medicine, we improved it. And in some areas, we improved it so confidently that we threw away things that worked. There is something that stays with you about a 31,000-year-old skeleton with a healed amputation. That person woke up on the worst day of their life. Something had gone terribly wrong. Someone in their group made a decision with a stone tool and no guarantee it would work. And then that person lived. They were carried. They were fed, they were treated with whatever that community knew about plants and pressure and fire and time. For years after, we talk about the ancient world like it was a place where people were constantly dying from minor things. And they were, but they were also doing something else, caring for each other under conditions we cannot fully imagine, with knowledge we are only now beginning to take seriously. For 300,000 years, before anyone understood germ theory, before anyone had ever heard the word antibiotic, humans were watching each other get hurt and refusing to do nothing. They packed wounds with plants that clotted blood. They dressed infections with mold that killed bacteria. They drilled into skulls and brought people back. They did not know the science, but they knew what worked. And the next time you reach for that bandage, without thinking twice, that reflex, that instinct to fix what is broken, is 300,000 years old. You inherited it from every single one of them.